Hi guys, welcome to Sato Career 2.0 online nursing channel. In today's video, we are going to discuss 10 important questions for AIIMS NORCET Exam 2024. Let's begin this video with the first question. The nurse treats an infected child. The nursing plan of care includes a risk for insufficient fluid volume due to the child's fever and poor fluid intake. Which intervention should the nurse include in this nursing diagnosis plan of care? Option A, administer intravenous fluid as prescribed. Option B, practice good hand washing technique. Option C, provide a cool mist humidification. Option C, use appropriate transmission based precaution. So, which is the right answer here? When the child is suffering from fluid volume deficit, the nurse should administer intravenous fluid as per the prescription order. Option A is right. Now let's move on to question 2. The critical care nurse provides care for a client who is admitted for the treatment of head trauma and prescribed mannitol to reduce the intracranial pressure. Which electrolyte is the priority for the nurse to monitor? Option A, potassium, B, sodium, C, magnesium, D, chloride. Let's see the right answer. When the patient who have head trauma and who is having increased intracranial pressure and who is on mannitol, the nurse need to monitor the electrolyte sodium. The mannitol is a hyper solution which may leads to increased intracranial pressure because of the sodium level. So the nurse has to be monitor sodium level in this case. Move on to question number 3. Which material would the graduate nurse require to test the functions of a patient's glossopharyngeal nerve? Option A, soft cotton swab and a toothpick. Option B, a stethoscope. Option C, tongue depressor. Option D, a handheld mirror. So here to test glossopharyngeal nerve, the ninth cranial nerve, to check the gag reflex, the nurse needs to have option C, depressor. Tongue depressor is the right answer. Move on to question number 4. A patient at the outpatient clinic describes leg pain that occurs while walking and is relieved with rest. The patient asks why this happens to him. The nurse knows that pain is related to option A, angina, B, heart failure, C, venous insufficiency, and D, arterial insufficiency. So the pain occurs during walking and at the rest the pain is relieved. This may be due to option D, insufficiency. The arterial insufficiency is sometimes caused due to intermittent claudication, which leads to pain while walking. Move on to fifth question. The nurse cares for a patient with myasthenia gravis. Which of the following symptom is not typically a part of the disease? A, ptosis. Option B, shuffling gait. Option C, muscle weakness. Option D, diplopia. So the stick future, which is not a part of myasthenia gravis here is the shuffling gait. You know well, shuffling gait is a part of Parkinsonism disease. The sixth question, a graduate refers a patient to undergo a liver biopsy. The graduate nurse administer what preoperative medication? Option A, vitamin A. Option B, vitamin B12. Option C, vitamin K and coumadin. So during liver biopsy, the nurse need to administer option C, vitamin K medication. Vitamin K helps to regulate any coagulant abnormality during the perioperative procedure. Move on to seventh question. The nurse is caring for a client after an electroconvulsive therapy treatment. The nurse is most concerned if which of the following is observed. Option A, the client complains of backache. Option B, the client is unable to recall her name. Option C, the client is unable to remember what she ate at breakfast. Option D, the client complains of backache. All these complaints are more common, they except option D, the complaints backache, which is unusual. So that has to be look for the priority treatment. 8. A patient begins hyperventilating due to panic attack. The registered nurse knows that the correct intervention is to option A, have the patient breathe into option B, call the physician. Option C, put the patient on 2 liters of oxygen. Option D, have the patient, you know very well, the patient is hyperventilating due to panic attack, and in that condition, the nurse has to instruct the patient to use option A, the pepper bag for breathing. So while using pepper bag, the nurse exhales the air and inhales the same air which contains less amount of oxygen that helps to minimize the hyperventilation symptoms. Question number 9. A patient with glaucoma asks the nurse what he can do to improve his vision. The nurse knows that vision loss from glaucoma can be corrected with glasses. Option B, vision loss from glaucoma will heal itself over time. Option C, vision loss from glaucoma can be helped with daily medication. Option D, vision loss from glaucoma is irreparable once present. The right answer is option D, vision loss from glaucoma is irreparable once present. It's due to the damage of the optic nerve. Now, move on to the 10th question in this video. The last question. After cardiac catheterization, the nurse instructs the patient to lie in which of the following position? Option A, right side lying position. B, lying on the back. Option C, Sims position. Option D, right side lying position. So you know well that patient after cardiac catheterization is made to lie on the back. Option B. So while the patient is lying on the back, the patient have less chances of bleeding. That's why we make the patient comfortable with lying on the back position. So that's all the 10 questions we have seen in today's video. Most important questions can be asked in the upcoming exams. So I hope you enjoy this video. Please like to this video and comment for this video. And don't forget to subscribe Satu Career 2.0 online nursing channel. Let us meet again with another 10 important questions. Still that, you all take care. Bye bye.